Hello, my name's Andrew Bird and I'm a stoma care nurse at the Queen's Medical Centre in Nottingham. I'm delighted you've shown interest in our article about implementing and evaluating a 7-day stoma care service. I was lucky enough to join the service at a time when the colorectal and stoma care nursing workload was changed from one service with 2 specialties to 2 independent services. As you can see from the article, through negotiations with the trust and industry, my manager was able to secure funds to employ the staff to allow this to happen. I was employed along with 3 other nurses, 2 nurse specialists and a healthcare assistant, to move the service forward, delivering a 7-day service with the expectation that the change would increase patient flow after surgery, enhance patient experience from both a stoma care nurse and a colorectal cancer point of view. The change in working patterns wasn't easy initially, but quickly it became apparent that it was a good move, with positive feedback from patients, ward staff and particularly the colorectal consultants, who quickly recognised the value of having a stoma care nurse around at the weekend to expedite discharges and to see patients listed for emergency stoma forming surgery. Analysis of the data kept by our team before and after the start of the 7-day working showed a reduced length of stay, so both the initial objectives were met. Unfortunately, due to a loss of a team member, we had to withdraw the weekend working and concentrate on a 5-day service. And since doing so, the impact of weekend working has had on our team, the ward staff, the consultants and most importantly the patients has been very apparent. Feedback from patients at the point of discharge has identified how they feel a gap in the service when we aren't around at the weekend, and the ward staff don't have time or the inclination sometimes to fill that gap. We've also noted an increase in workload during the week, particularly on Mondays when we try to cram in a weekend's worth of work to try and get patients who are medically fit for discharge home. I'm pleased to say that we've now recruited and the weekend service is to be resumed. Thanks again for your interest, and please feel free to get in touch via email to andrew.bird@nuh.nhs.uk if you have any questions or comments.